In this video lecture, we're going to be looking at the Administrative Dental Assistant book, page 162 in Chapter 10, Scenario 1, the emergency patient. So in this scenario, Dorothy Starr calls the office and informs that she has a pounding toothache and has to see the dentist today. With the help of the telephone information form, questions can be asked to determine where the pain is located, how long the pain has been present, if there's swelling, and whether there are other symptoms that will help to determine whether the patient needs to be seen today. If the appointment book has been matrixed to allow for emergency patients, the patient can be informed of the appointment time and is advisable to tell emergency patients that the dentist can see them for immediate problem and relieve the discomfort. If more extensive work is needed, another appointment time must be made. So some of the questions that we might ask this patient is how long they've been in pain, if they're taking anything over the counter for this pain. We can also ask them where in the mouth it's located and if they're noticing any bleeding or swelling. If the emergency time has not been worked into the daily schedule, a time need a time will need to be selected. Find a scheduled procedure that will allow the dentist to leave this patient momentarily to attend to the emergency patient without interfering with the amount of time scheduled for the first patient. So when we look at the schedule, we can kind of take a peek at where our patients are scheduled and what they're scheduled for. If we have a longer appointment where the patient will need anesthetic, there might be a few minutes for the dentist to sneak away and do this exam for the emergency patient and then go back to the procedure that was originally scheduled. Remember, dentists shall be obligated to make reasonable arrangements for the emergency care of their patients of record. Dentists shall be obligated when consulted in an emergency by patients not of record to make reasonable arrangements for emergency care. If treatment is provided, the dentist, upon completion of treatment, is obligated to return the patient to his or her regular dentist unless the patient expresses that they have a different preference. Sometimes patients cannot come in during a period when you can work them in. If these patients can wait, they can be scheduled for another day. However, the dental healthcare team may need to be flexible and schedule the patient at a different time, such as during someone's lunch hour or at the end of the day. This type of scheduling should be avoided and done only after all other options have been explored. Matrix the appointment book with cushion times, one in the morning and another in the afternoon, that can be used for emergency appointments or to help readjust the schedule on a busy day. Check the schedule for a time when the dentist can momentarily leave the patient. For example, when we're waiting for anesthetic, when the expanded function dental assistant is completing a procedure, when there is a patient who is scheduled for multiple procedures and his or her appointment could be shortened without causing inconvenience. To make sure a treatment room is available for radiography and treatment, check the schedule of other dentists in the practice.